Traditional Filipino cultural practices involve social gatherings and celebration which are centered around food, which can lead to overconsumption of high-calorie and high-sugary foods, including also, not to mention that the Filipino diet is typically high in refined carbohydrates, added sugar, and unhealthy fats, which can contribute to obesity and insulin resistance and elevated blood glucose level. Now, the popular Filipino dishes such as our favorite, the adobo, pancit, and lechon, they are often prepared with ingredients high in sodium, cholesterol, and saturated fats, which can impact blood glucose control. And also, our preference for processed and fast food can further exacerbate the risk of diabetes in Filipino community. Not to mention that sedentary lifestyle due to factors such as long hours of work, commuting, and limited access to safe and recreational spaces can also contribute to obesity and insulin resistance in Filipino individuals and the community. Another one is smoking and alcohol consumption, which are prevalent among the Filipino communities, can also increase the risk of developing type 2 diabetes and other related complications. So barriers to healthcare access, including language barriers, the lack of health insurance, and other cultural beliefs may also prevent individuals or the Filipinos from receiving timely diabetes screening, education, and management. There are two types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes occurs in individuals among early childhood to adolescence. And this occurs in individuals in which there is an autoimmune destruction of the pancreas that makes insulin. And so if a person which has destruction of the pancreas, it will unable to produce insulin. Thus, individuals will be needing insulin for life. While type 2 diabetes is the most common, it occurs in adulthood but is now commonly seen among early adolescents. It is caused by inability of the pancreas to produce insulin, and there is also excessive production of glucose coming from the liver, and also inability of the body to utilize the glucose, which leads to elevated blood glucose level. And this is referred to as insulin resistance. The most common symptoms of diabetes includes frequent urination, feeling of thirst or dryness of the throat. They easily get hungry, weight loss. Some would also complain of itchiness, particularly vaginal itchiness, recurrent or non-healing wound. Those are usually the most common symptoms of diabetes. Get regular health check. Here in Medical City, we have an endocrine diabetes thyroid center which can help you assess and help you screen for patients who have increased risk for diabetes. So by implementing these preventive measures, making healthy lifestyle choices, individuals can significantly reduce the risk of developing diabetes and improve their overall health and well-being.